Did you know that colorectal cancer is the third most common cancer in both men and women? But it is also one of the most preventable? Early detection through screening can save lives. And today we'll discuss the importance of awareness, the latest advancements in research, and the resources available for patients and families. Hello, and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. Dr. Sriram Rangarajan from Orlando Health Colon and Rectal Institute is here to start our conversation about colorectal cancers. Number one, it's not something that people want to talk about. So let's just put that out there.
Absolutely.
It is the third most common and yet one of the most preventable. That is kind of confusing to me. If it's one of the most preventable, then shouldn't we be talking about it?
You're right. It should not be as common as it is if it's one of the most preventable. As you sort of allude to, there is a stigma associated with getting screened for colon rectal cancer and even talking about it. Colonoscopy is a procedure that has to be done to screen, and it involves a bowel prep. It involves, a camera looking at your entire colon. And there's definitely some fear and hesitation amongst people when thinking about this, but as a colorectal surgeon and someone who performs colonoscopy, I make it a point every patient I see, whether I'm seeing a patient for hemorrhoids or for colon cancer or for diverticulitis, any sort of disease process, to talk about this, because everyone's at risk for colon and rectal cancer.
Well, let's define it first and then talk about the risk factors. How would you define colorectal cancer?
So colorectal cancer is an abnormal growth in the lining of your colon, and this is referred to as a polyp.
Okay.
So polyps form in certain people. There's a genetic component to it. There are also environmental things that we do that may increase the risk of these forming, but the basis of colon cancer is polyp formation.
So let's talk about the genetic predisposition. Are there certain groups that are more prone than others?
There are certain genetic syndromes that people can get. 80% of colorectal cancer is sporadic. So what that means is anyone can get it, and there's no genetic basis to it. So that means 20% is not sporadic, or it's hereditary.
That's a pretty high number, 8 out of 10 people.
Yeah.
Yeah. So the sporadic, that's not a word you want to hear when somebody's talking about cancer. So what are the things we can do to kind of make sure we're in that 20%?
Sure. So things we can do to try to prevent or increase our risk of not getting colon cancer. There have been studies linking increased fiber intake and actually increased dairy intake to decreasing your risk of developing colon cancer.
So those are good things.
Those are good
More
things.
fiber and dairy.
Correct.
What
And
are the bad things?
increased consumption of red meats, increased consumption of processed meats, and increased consumption of alcohol are 3 things that have been linked to the increased risk of developing colon cancer.
When should you get screened initially? Is there a best practices age?
Yeah. The American Cancer Society and the American Society for Colon and Rectal Surgeons both recommend screening starts at age 45 for average risk people. That means people that don't have any direct relatives that have colon and rectal cancer, people that have never had colon cancer themselves.
Okay.
Now, if your mom or dad or your brother or sister has colon cancer, the recommendation is to get screened 10 years before that person got colon cancer. So if your
Okay.
dad got it at age 40, you should get screened at age 30.
And is there a fear around the procedure itself?
I think there is, but I simply think that's because people don't truly understand what's going on and what the risks are and what the benefits are. This is a this is not a surgical test. This is what we'd call a procedure. A colonoscope, or really a telescope, a very tiny, about the size of a dime or a quarter scope, is inserted through your anus
And you're
with lights.
asleep.
And you're fast asleep.
Yeah, you're not aware
Correct.
of what's going on.
Correct.
Just to have a good nap and yeah.
Yeah, the medication you get puts you in what we call a twilight, so you really have no idea what is going on, and you are sleeping, you know?
So what would you say to people who are still going, no, I don't want to do that?
I would hearken back to one of the first things you said. One of the most preventable causes of cancer. And, you know, you owe it to yourself and your family to get screened, to keep yourself safe from this, because it is not only very preventable, it's very treatable. And you can only treat it if you know you have it.
So what groups do you see who wait the longest? Is it women? Is it men? Is it who waits longer?
I think what I've seen is people not from this country tend to wait longer. So
Okay.
immigrants tend to. I think it's because the screening, you know, the regimented screening processes that are present here are not present in other countries.
Okay.
So that's something I've noticed. I think people from lower socioeconomic backgrounds sometimes wait because of access issues. So they don't have access to colonoscopy. I don't think it's because they won't do it. It's because their social situations don't allow them the opportunity to get it.
What are you most excited about on the horizon in terms of lowering these numbers?
I think, one, the fact that more and more colorectal surgeons and endoscopists are being more aggressive about doing this. Anyone that walks in our office, we're talking about it, trying to do more outreach within our communities with regards to this. I think education, outreach, and focusing on it is really what I'm trying to do.
And for someone who's listening, who's like, well, okay, maybe I should, what would you tell them? They're still kind of on the fence, but at least they're on the fence.
Yeah, I mean, I would love to be able to speak with them and give them information about what the different screening tests are, why I believe colonoscopy is, you know, the gold standard and one that, you know, should be considered. But, you know, I would just want them to get screened. So there are other ways to be screened.
Signs. What signs should you look for that there may be a problem?
Sometimes there's no sign at all. And I think the
Wow.
most common presenting symptoms for colon cancer is nothing. So
you can't even fall back on that and say,
Correct.
well, I haven't had that symptom.
Correct.
Sometimes there are no symptoms.
There are no symptoms.
You're just taking away all of the arguments for not getting
Right.
tested, which is exactly what we wanted to do here today.
now, other symptoms where it's more developed, your colon cancer has grown, include blood in your stool, abdominal pain, feelings of fullness, loss of weight. So these are sort of alarming signs. But as I mentioned, many patients don't have any of these and are found to have colon cancer.
Well, thank you for doing the work you're doing and for being here to spread awareness and education.
It's my pleasure.
More right after this. Don't go away. Chelsea Edwards, Senior Director of the Colorectal Cancer Alliance, is here to share a little bit about their organization and what it's doing to spread the word and raise awareness about colorectal cancer. Chelsea, thanks for joining us. So
Hi, thanks so much for having me.
let's start with the basics. What does the Alliance do and why does it exist?
Sure. Well, the Colorectal Cancer Alliance is the largest nonprofit focused on colorectal cancer in the United States of America, and we focus on advancing research and raising awareness about this highly preventable disease. It's unfortunately also a really prevalent disease amongst all types of different people.
You know, that's interesting that it is the third most common cancer and one of the most preventable. So, what's going on here? Is it that people are afraid or they're not aware? What do you think is happening?
Yeah, I think there's a couple of things at play. I think that there is certainly a fear around it. I think there's also such a stigma. This is a part of the body that's not fun to talk about, not comfortable to talk about. And the symptoms that come with this disease sometimes also are just not something that we're talking about at the dinner table or we're, chit chatting with friends, in our free time about. So there's a stigma and there's a silence that comes with this disease. And I think that only allows the disease to be more prevalent. So we do a lot in the face of that stigma where Lead from Behind, our partnership with Ryan Reynolds and Maximum Effort, and we've partnered with celebrities like Dak Prescott as well to really raise awareness, to try and shed that stigma, and just get people to start talking about it. Because I think that's the first step in terms of awareness is overcoming that stigma and that silence that oftentimes comes with the symptoms of this disease, with the testing, to find and prevent this disease and the disease itself. And we also really are empowering our community across the country to reject that stigma, to kind of be loud about their experiences, and really be proud of what they've overcome in order to help others and hopefully save lives.
So, what do you need most from the public, from people like you and me, someone who may be watching this? What can we do? Because sometimes it seems like a big Herculean task to advance toward a cure or reducing numbers. What's the easiest way people can get involved?
Yeah, I mean, I think that there's a couple of really easy things folks can do. One is get screened. If you're 45 or older, or if you have symptoms or history, talk to your doctor about getting screened, and talk to your loved ones about it. We all know who our loved ones are who are at 45 years or older. If someone's talking about having symptoms, if we know that there's a family history, just spread the word. Tell everyone that will listen. I know me personally, I do the same in my personal life, that if I know somebody is in that age or that risk factor, that, I'm talking to them and I'm, having that uncomfortable conversation about, have you had your colonoscopy and getting that set up. So I think that's the first and foremost and easiest thing. I think there's other, very simple ways that folks can support our mission, by our new and a very exciting program that we're rolling out this year called End Colon Cancer Coast to Coast. And this is a movement and initiative that our community can rally around to raise funds and awareness for our mission and for to save patients and to raise funds for our life-saving mission.
Well, what are you most excited about in this fight to reduce those numbers?
Yeah, I think that there are so many really amazing things happening at the Alliance. We're working on a project called Blue HQ that will give patients a one-stop shop to kind of go through their journey, to have support, to connect to the life-saving treatment and support that they need. And it's something that, 5, 10, 20 years ago just didn't exist. And so we are really at the beginning of, really some great innovation and the cutting edge in terms of patient care and the cancer care continuum. I'm also really excited about how we're mobilizing our community. As I mentioned, our End Colon Cancer Coast to Coast, our Walk to End Colon Cancer program, and so many community-based fundraising and awareness initiatives that we've got going on. I think we are the leader in many ways, not only when it comes to innovation and cancer care, but also just in the way that we mobilize our community and that we're bringing the CRC community together. One of the, I think, biggest risk factors in my opinion is just the lack of community and folks not understanding that there are so many other people out there that are going through the same thing, that they may be able to talk to and relate to. And we're doing a lot of different things to make sure those folks find their community and find the people that can help support them.
Do you help people mobilize? Do you show them how to get the word out? Is there assistance, for instance, in places of worship, civic, social groups to kind of keep this conversation moving forward? Do you help people in that way?
Yes, absolutely. And I think in 2025, we've got a renewed focus on that. So we have started building out resource libraries for our volunteers and our fundraisers that want to get involved and want to support, so that we've got plug and play templates and information for people, that they're not alone if they want to do something to support us. We've got lots of resources out there, and we're building more each and every day to make sure that if somebody wants to help us, that they have everything they need to do just that. So it's all out there on our website to get started, and then we've got some incredible staff that are available to support as well. We think it's important that if somebody wants to help, that they have everything at their fingertips, and that they're able to do that.
And of course, screenings are the most important thing of
Yes.
all. I often ask, what's worse, a diagnosis that can't be turned around or having an uncomfortable conversation that will save your life? And sounds like the
Absolutely.
answer is pretty obvious.
Yes, absolutely. I couldn't agree more.
Well, thank you for being with us. And if you want to help in your local community, all of the information you need is right there at your fingertips. We will be back right after this. As we've heard today, colorectal cancer is the third highest cancer among men and women. But we've also heard that with early detection and prevention, it is one of the most treatable. Take care of yourself so you can maintain healthy connections. We'll see you next time.